Good afternoon. My name is Michelle Williams. I'm a third-year medical student at Albany Medical College, and today I will be talking to you about the contrast between medical student interest in neurosurgery and the needs of the neurosurgical field of the future, an opportunity to reevaluate residency selection metrics. To introduce this topic, the US population has been increasing in diversity for a very long time, and medical schools currently are struggling to close the gap in diversity with recruitment measures. However, increased diversity has been shown to improve a number of health and education metrics. Evidence of healthcare disparities also exists specifically in the field of neurosurgery related to social and structural determinants of health, such as race and socioeconomic status. These can be especially difficult to tackle in the field of neurosurgery when services tend to be clustered in more high-density population areas with sufficient technology and facilities to accommodate the types of procedures that neurosurgeons tend to do. This often leaves medically underserved communities at a disadvantage, though. And further elaborating on this topic, students of underrepresented and low-income backgrounds tend to be more likely to serve underserved populations, but this specific point hasn't really been researched in neurosurgery, a need that this study hopes to cover. So the purpose of our study, first and foremost, is to characterize the demographic and academic activities that tend to influence whether matriculating medical students express an interest in neurosurgery. And our second purpose is to further characterize which of those particular students will express an interest in working with underserved populations, all in the hopes of increasing the number of students who express an interest in working with these populations within the field of neurosurgery. So in terms of our methods, we gathered data from the AAMC student record system and GQ questionnaire given to fourth-year medical students. We analyzed specifically data for the years 2012 to 2017 using chi-squared and multivariate logic regression models. Overall, 48,096 medical students graduating in an MD providing school had complete data sets that we could use to provide our results. Of those 48,096 students, 607 expressed an interest in neurosurgery, and only 11 of those neurosurgery students expressed an intention to work with underserved populations. As you can see here from our results, there was a lot of significant data that was obtained from this particular data set, but the highlights are that fewer students interested in neurosurgery identified as female versus non-neurosurgery specialties, a topic which has previously been brought up within the neurosurgery community. But fewer students interested in neurosurgery expressed an intention to work with underserved populations as well versus the national cohort, which may contribute to the issue of serving underserved populations in the future. Students identifying as Black or African American were also, interestingly enough, more likely to express an intention to pursue neurosurgery versus the Caucasian population that we used as the basis of our comparison. However, among the neurosurgery cohort, students that identified as Black, African American, Hispanic, or female were also more likely to report an intention to work with underserved populations, even though the general cohort of neurosurgery interested students were less likely to report that intention. The limitations on our data, of course, is that we have a specific data set of 5 years that we analyzed. Students before or after that data set, of course, are not included. Aside from that, we don't actually have the respondents' eventual career choices and match outcomes to verify that their intention did translate into a position at a neurosurgical program. And we also do not have data on DO students or students of other healthcare industries. which is a future direction that we would like to take. And of course, as we previously mentioned, students who didn't have complete data had to be excluded. So in discussion of these findings, the most interesting to our team was that females are significantly less likely to express an interest in neurosurgery, something that's been touched on before, but again is being demonstrated in our data. It was also interesting that Black and African American identifying students were actually more likely to express an intention in neurosurgery versus their Caucasian counterparts, and that students of most other ethnic groups were actually just as likely as Caucasian students to express an interest, meaning that the interest in these underrepresented populations to join the neurosurgery field is there. It does exist, which is good news if we were to tackle underserved populations. And specifically within neurosurgery interested students that are intending to work with underserved populations, it seems that neurosurgery interested students overall are not as interested in working with underserved populations versus the national cohort. Female, Black / African American, and Hispanic students do actually tend to be more interested in working with underserved populations within the field of neurosurgery versus their counterparts. And neurosurgery interested students, in terms of academic experiences, tend to work less in free clinics for the underserved or engaging in global health activities. Two things that would kind of spark that interest in a lot of students to work with underserved populations. Overall, I think that our study identifies several demographic and academic factors for neurosurgery interested students, and specifically neurosurgery interested students with an intention to work with underserved populations. That data is especially useful now as neurosurgery strives towards providing more holistic care to all patients who have needs. Therefore, our study kind of supports that increasing diversity in the neurosurgery field would then lead to an increase in the future number of neurosurgeons interested in working with underserved populations. And therefore, we could grow that interest by very focused intentions within our recruitment and retention policies within the neurosurgery field to eventually grow the number of neurosurgeons interested in working with these populations to then meet the needs of our future increasingly diverse population in the United States. Future directions, of course, would be to expand the project to investigate more DO schools and those of other health practitioner training programs like PA and nursing students, as well as a more comprehensive and detailed investigation into the characteristics that successfully allowed neurosurgery interested students to matriculate into the specialty, and more study on the existing disparities that are at work within the field, because that has previously not been well covered, prompting this study in the first place. Aside from that, I would quickly like to thank the Albany Medical College Department of Neurosurgery, the University of Texas Southwestern Medical Center, Yale School of Medicine, Tufts University School of Medicine, and all of my team members from those institutions in supporting me in the study of this project. I would also like to thank my mentor, Dr. Pilitsis. Thank you for the opportunity to present, and I hope that you enjoy the rest of this conference. Thank you.